Okay. Well, I'm super excited today to be able to have an opportunity to interact with and interview Dr. Veronique Mead from Colorado. And Dr. Mead and I just recently made acquaintances with each other, but I've been reading some of the work that she's published, and it has really been a game changer for me in my practice here in Austin with patients with what I call chronic complex illness. But Dr. Mead worked for the beginning part of her career as a family physician and was an assistant professor at the New Hampshire Dartmouth campus in the 1990s. And she'll tell you more that she had an encounter with chronic illness which changed her path. And subsequently, she went to Europa University and studied psychotherapy and became an integrator. For the last 20 years, Dr. Mead has looked at and researched environmental stressors and adverse life experiences, or what I like to call life toxins, life crisis toxins, to actually help people learn to shape their health. The research also explains how the effects of these sorts of traumas and toxins are absolutely not psychological, but neurophysiological, and actually affect our genes, our nervous systems, in fact, the way each and every cell of our body functions. So Dr. Mead's testing and refining of these perspectives, along with her own personal journey with chronic illness, has brought her to where she is. She currently is the main author of Chronic Illness Trauma Studies. That's chronicillnesstraumastudies.com. And I would encourage all of the viewers to go and interact with that site where they can learn a lot more. So, well, welcome, Dr. Mead. It's good to have you, and I'm just excited that we can share what you have with our viewers. So the first, I'm sorry, go ahead.
I just wanted to say it's good to meet you, and please call me Veronique.
All right, I'll do that, absolutely. So the first thing I wanted to start off by asking you, Veronique, is just go ahead and share with us, if you would, kind of your own personal story of what's going on in your life and how it's brought you to where you are today.
Well, 20 years ago, when I was a family practice physician, I was really feeling a lack of knowledge base from what I'd learned and what I had for tools for working with people who had chronic illnesses. And it wasn't as clear as that back then, but that's been sort of what's shaped and guided my path, to the point where I left medicine back then. And at the beginning, I was having what I called back then fatigue attacks. I would get really extremely tired for a day or a few days. And it was the kind of tiredness where I would actually, it would take effort to roll over in bed at night, which is, I mean, who would even think of that as being a kind of fatigue that would be within normal range? And I really had no context for it back then. And I did a few little lab tests on my own. I made sure my blood sugars were okay, and I didn't have diabetes or low blood sugar or a thyroid problem. And everything looked totally normal. And so I just figured, this got to be stress related. I had that sort of perspective as a physician that a lot of these things could be stress related. And I also felt a conflict with my path in medicine and the tools that felt limiting to me. So I left medicine, took a year off, and I really thought that de-stressing would make a huge difference, and my health actually got worse. And so, yeah, I went from having these isolated fatigue attacks to something that very gradually over 10 years became much more of a steady state. I developed a much greater baseline of fatigue, and eventually decided and got diagnosis as being chronic fatigue syndrome, which is kind of a not very helpful name. It's kind of hard to share that name. A lot of people have that feeling with this name for this disease that makes it seem as though it's just about being tired. But I retrained as go ahead.
We may want to talk at some point about some of the names that have been put on, or to pigeonhole some of the symptoms of what I call chronic complex illness, which does include chronic fatigue and chronic aches and pains that they call fibromyalgia. But whatever name you put on it, Western traditional medicine has a whole boatload that they use. But at the end of the day, it's all really just as complex, what I call chronic complex illness, or a lot of people actually call it environmentally acquired illness. But anyway, I just wanted to interject that real quick, because I know that you have some frustration about that name.
I think a lot of people with this illness have frustration with that name, and that's just one piece of the puzzle. But I love the idea of chronic complex illness, because it really, if you start to think about that, and that's part of what we wanted to talk about today, you and I, is it ends up fitting all kinds of diseases, including autoimmune diseases like type 1 diabetes and multiple sclerosis and lupus, that have perhaps more validity in the way they're recognized. So for me, I had no idea that I was at the beginning of a chronic illness, and that happens for a lot of folks. Some people get sick very quickly after an infection. I imagine you see that a lot in your practice. But for me, it was a very gradual process. So it was kind of a surprise to keep seeing that even with stress reduction and self-care and those kinds of things, I continued to get worse. But as part of this change that I was making, I did end up retraining in a field where I could learn how to listen to the body. I really had this sense that there's intelligence in the symptoms and there's intelligence to what's happening in the body. And how do we listen to that? And how do we work with each individual person? Because our histories are all so different. And when I was at Europa doing this new training, I got introduced to a lot of the research where they look at how life experiences, toxic life experiences, I like that way of thinking about it, influence our risk for mental illness, depression, anxiety, PTSD. And it made me curious whether anything like this could affect risk for chronic illness, not because it's psychological, but because there might be something going on in our physiology that was getting interrupted. And so I started thinking about fight, flight, freeze responses, and what would happen if those got interrupted or stuck somewhere in that cycle? And could that lead to a chronic disease?
Exactly. So fast forward now to lots and lots of work with different folks, and lots and lots of research from some really interesting lines of science and study from some other great folks. And it's kind of brought you where you are today and what you write about now on chronic illness trauma studies. So why don't you tell us, sort of skipping over a little bit, of where you are now and kind of what everything in life up until now has brought you in terms of what you think about now these chronic complex illnesses like chronic fatigue syndrome and lupus and diabetes and autoimmunity and even psychiatric disease.
I do think from the research I've found, and just to be clear, I haven't done any research myself. I've just been integrating other people's research, looking to see if there is any research that supports or that supported this initial way I was thinking. And I've ended up finding a ton of stuff, so much so I can't keep up. There's more and more coming out now. But the way I've started pulling things together is that chronic diseases of all kinds seem to have very similar contributing risk factors, these toxic life exposures as you talk about them, and that it's very similar whether it's a chronic physical illness, an autoimmune disease, or chronic fatigue or fibromyalgia, or whether it's a mental illness or addictions, obesity. There's a way that I've started to see the research pulling it all together from a very similar view, which is that it is a series of hits, as they talk about it in a lot of the literature, that accumulate over time for some of us to lead to different chronic health problems. Very serious illnesses. I mean, I was disabled for years. I haven't actually been able to see clients myself for 10 years. My worst in my own health, I was mostly bedridden, housebound. I had trouble sitting up for more than 5 minutes at a time without my heart rate speeding up and feeling more exhausted. And so, you know, all these kinds of serious illnesses seem to have very similar origins. And I've started to think of them to divide things in a way as different periods of time where these exposures can have long-term effects. I've looked a lot at trauma, so multi-generational trauma, a trauma and adversity during pregnancy, in birth, difficult birth, very early infancy. There's the biggest, most well-known set of studies. There's hundreds of them now. Are the adverse childhood experiences studies?
The ACEs.
The ACEs, yeah, and then the hits that we have in adulthood before the onset. And so the other exposures, like the toxins, as you refer to, they can include infections or mold exposure or pesticides. All of these things seem to elicit a threat response. And if that, go ahead.
Well, I was just going to interject that the way I found you was I was doing some Googling, as I always do. It's anymore with the internet. We have so many amazing resources to pursue our education and taking us forward in our fields of endeavor. But I was looking at some information about the mitochondrial cell danger response that I know we're going to talk about. Dr. Robert Navio's work from San Diego with the mitochondria and the way these toxins interplay with that. And I think I was cross-referencing limbic system or autonomic nervous system, and you popped up on page 1 or 2 of the search, and it took me to your studies, and I started reading those. And for the last several weeks, that's all I've really done in my spare time is read a lot of your work, because you might not be a researcher, but you're an amazing integrator, and some of the conclusions that you're drawing, they resonate absolutely 100%. Of course, you and I come from totally, in a way, from 180-degree opposite directions, because I started off as an ear, nose, and throat doctor, a surgeon, head and neck surgeon. And although I was able to do a lot of good for a lot of people, we did a lot of sinus surgery, we took tonsils out, we even took some cancers out. I did a lot of allergy work. But earlier in my career, I was coming up against some people that were chronically ill. Again, now I look back, they had chronic complex illness. And many of those patients were actually ill primarily from exposure to chemical toxins, most specifically agricultural toxins. And we were seeing people that were closest to the exposures, the farmers or the families of the farmers that drank from wells that were directly drained from the crops that were receiving all these toxins. And we were seeing all these really bizarre and unusual symptoms like cancers and autoimmune disease, psychiatric disease, so forth. So right away, I realized that the tools in the Western toolbox that I'd been given weren't working. Mm-hmm. And that they had these root causes, and I was just aware that they were, in this case, largely chemical. And so I started to drift in a different direction toward what we call functional medicine, or I prefer to call it integrative medicine, which means that I still haven't given up all of my Western tools. I integrate functional and traditional. But the point is we've gone to more natural ways of discovering the root causes and really unlocking the body's own innate ability to heal itself if you get out of the way. That means if you remove the toxins, if you avoid exposure to toxins, and if you enable the body by putting in the necessary foods and nutrients. But anyway, that's how I got where I am. And then over the last, I'd say 3 or 4 years, I've just become so much more aware of the role that the brain plays in all of this, the nervous system, the response to stress. And I think I might have told you that I like to take a real thorough history with all my patients, because I think that's the most important thing I can do to understand what's wrong with my patients. It's just absolutely, it probably gives me a good 80% as compared to exam and labs. I mean, they can all play a role, but history is huge. But when I take a history from my patients, I always ask them, when did you really first deviate from your sense of wellness? And a lot of times people will describe that they weren't 100%, but they were getting along pretty well until, and then they'll say until. And it's that until that for me is really interesting, because I find that it's about a 50-50 split between a actual toxin exposure. So like maybe they got exposed to a drift from a pesticide, or maybe they had a stomach flu, or maybe they caught mono, or maybe they moved into a house that was very, very moldy. But anyway, a real environmental exposure. And then the other half of the time, it's amazing to hear people say that it was a life crisis. It was a traumatic life event. I mean, maybe it was the learning of the death of a close family member or even a close pet. Or maybe it was finding out that their child had a terminal illness, or that their husband had been unfaithful, or that their business that they had grown was going to have to file Chapter 11 bankruptcy. I mean, situations like that, and then boom, it was like the next day, my patient had all of this litany of symptoms of chronic complex illness, with probably at the top of that list being fatigue. People that can't really even get out of bed or turn over. So that's my story. And so I realized, because of the role of these life toxins that are, to me, every bit as serious to a person's health as a pesticide or mercury or Lyme or monovirus or mold exposure. But anyway, I would like you to kind of pick up where, before I interrupted you, kind of pick up with where your recent studies have led you, especially in terms of the role of the cell itself and even the mitochondria in this response to these various toxins, including the life toxins.
The whole cell danger response, finding out about Dr. Navio's research, has been really helpful for me in the sense of validating the big picture of different models that I've been finding. And so the sense that our cells have their own way of dealing with danger or threat in order to protect themselves as cells and protect themselves as tissues and protect our organ systems makes a lot of sense. And what Dr. Navio has brought in is, through his metabolic studies, is finding that this cell danger response can get stuck. And that's what leads to, as he puts it, over 100 different diseases. He's calling this a new paradigm of disease. And it's kind of what you and I are really finding has a lot of powerful context to help think about our illnesses and things like triggers and flares, how to put all that together. And so I don't think about it really, I personally don't look at the tiny details of what chemical, what enzyme, what cell is having a problem. But that research validates the picture. I tend to think of it from a nervous system perspective, from my training as a trauma therapist. And seeing that our systems have gotten stuck in fight, flight, or freeze, or some combination of that. So that's kind of how I've started thinking about my symptoms and looking at disease as a system that's stuck. It's a system that's designed to heal on its own, given enough space and resource and support, but that some things gotten stuck. And so it really looks like it's an accumulation of these toxins, life toxins, chemicals, any different combination of those that has gotten something stuck in our system. And how do we get unstuck? That's kind of the $1 million or $64 million question, really.
Exactly. And you know, this isn't really an opportunity to delve too much into Dr. Navio's specific work, but I will just tell the viewers that on your site, you do go into a lot of detail about his actual research, and you cite a lot of his works. And I would say that even going back to his original literature, which is all fairly recent, his first initial watermark paper was 2014. But I would highly encourage people to study what he's said and written to learn more about this. But I absolutely do believe that he is presenting, along with what you and I are talking about, what really is going to be a change the paradigm of thinking about these chronic illnesses. and the way that the toxins in our bodies interact with our nervous system's threat response, and that the nervous system in turn, because of its somatic interplay through the vagus nerve and the sympathetic chain to all of our organs, actually does give rise to most of these symptoms that we're seeing. And again, they're not psychological. They're as real as the sunshine, but they're actually related specifically to the response of the body, the neurophysiologic response. And as such, I've been finding, and others can say as well, that they're absolutely modifiable once they're understood and once steps can be taken, not only to remove the toxins or remove exposure, but in many cases to change the body's sensitivity to the toxins, which can have to do with things like nutrition and diet and lifestyle and sleep and exercise and so forth. But also some things that you can do specifically to try to learn to mold the autonomic nervous system through what we call neuroplasticity, which is would be another subject maybe of another hour's discussion. But what I was hoping we could do is maybe have you go into a little bit of maybe what you've learned for your own personal recovery, and things that you've also seen of benefit that maybe our listeners, some of them were saying, okay, enough already, I believe you. I believe that's what's going on here. And but what can I do about it? And I could talk all day about what we could do about the toxins and a person's individual sensitivity to toxins, but I'd like to take the advantage of having you as a trauma therapist with your background talk a little bit more about what are some things that may resonate with our viewers that they could learn to do there.
One of the things, just in talking with you, is for people to have a healthcare professional, their doctor, someone who actually gets what they're saying and believes them, regardless of what their symptoms are, their diagnosis is huge. Just being believed is already something bigger than most of us, I think, realize, and that even as when we were in our training, our medical training, that we ever really realized. So I just want to name and acknowledge that, what a difference that can make, so that as healthcare professionals start to get this model of disease, it can really make a big difference. Because there's no quick fix, right? I imagine you have some folks who get better fairly quickly, and then there's a chunk that really struggle.
Yeah, I just earlier today to a patient who, unfortunately, I think she's a little bit deeper stuck. She actually has some personal life crisis issues, and I think she's pretty much in dorsal vagal or freeze, kind of that helpless and hopeless, which is where we focused a lot of our time. But I told her about a patient that I'd seen maybe 3 or 4 months ago. It was a younger patient and had all of these symptoms of chronic complex illness, but they were a fairly recent onset. And, we're talking 6 to 8 weeks. And so we went through all the things. I told her how the worst toxin always in my mind is mold, and mold toxins, usually from water damaged building exposures, things like ochratoxin and aflatoxin and trichothecene toxins, and that we needed to make sure she didn't have ongoing exposure and then do all of these other things. Well, she came back after 6 weeks, and she said, oh, well, you know what? First of all, I want to thank you so much because I'm feeling so much better. I bet I'm 80% well. And I said, oh, well, praise the Lord. That's just amazing. And I said, what's going on? She goes, oh, well, I got to tell you, my husband went in my pantry, and behind the cereal boxes, there was a bag of potatoes that were liquid potatoes. They were kind of like blackish green liquid potatoes. And he took them out, put them in the dumpster, and we ran an air purifier, and he cleaned the pantry out. And within about 3 or 4 days, I was like 50% better. And now I'm about 80% better. And she said, I think I'm on the way to being 100% better. And I said, well, I mean, you're one of the lucky ones. But yes, that is an example of what we sometimes see. But then for every one of those, there's probably 10 or 20 that were sick since, grammar school or high school, or even they don't remember when they were well, or maybe 6 years ago or 10 years ago when they got bitten by a tick and then they got a bullseye rash, or maybe they moved into an apartment that smelled really musty, but they couldn't move out. So there's other situations, but and then there's people that seems to be all about life crisis, and some of those are people that will tell you, well, I was from a very troubled childhood. I had an abusive father who was an alcoholic, or something like that. We hear that all the time. So anyway, I just interject that a little bit in response to your question.
Yeah, I wanted to bring that up because the fact that some people get better so quickly really makes a lot of people wonder what's possible. Can't they get better quickly too? And I think that's the challenge. So before I wanted to go into anything, the 10-to-1 or whatever that ratio is, I've been sick for 20 years. I've been working on it for maybe 15, 18. And what I've done has helped. It slowed, I think, the progression of my illness, and then helped gradually begin to reverse it. But I actually had to stop working and was at my worst within a week. When I stopped working, I didn't even know I was that depleted. And then it's been a very slow, gradual process of improving over 10 years, which you hate to say that because it sounds so discouraging, but it's also the reality. Some people have been sick for decades. And so I think about a big picture. I don't think there's a linear, straightforward way through this, and there's no quick fix for most people. But what this context about the cell danger response and the nervous system patterns offers are some guideposts. And so the more you understand how trauma, adversity, toxicity affects our threat response and perception, the more you can actually understand and find your way through what works for you. And so I tend to think of it as one big thing is to decrease the stress load, the toxin load. So whether that's looking for mold, if that's been identified, that can make a big difference. But it can be very hard if you start looking in your environment for every little thing. That can be very stressful in and of itself. So I tend to think about how can you overall start to decrease your load? Are you working too many hours? Are you sleeping? Do you have a support system in your life? Do you have someone you can talk to who makes a difference? Do you feel safe? How do you introduce those things into your environment if they're missing? They're really important.
I talk to my patients about me time. Needing me time, It seems like these days we're always worried about, others, our children, our grandchildren, our colleagues, our friends. A lot of times we just don't give us enough me time, focusing on what our personal needs might be.
Yeah, and we're in such a sped up culture that values being workaholics, that it's very hard to actually slow down, and it's hard to take the time to actually check in with yourself and see what your own system needs. And so anything that helps you feel supported, that helps your system settle, that helps you feel safe or safer in some way, actually is speaking directly to your nervous system. And it's a way to begin to counteract a nervous system that's caught in a sense of threat. And so this is also where things like diet fit in. I had a growing problem with intolerances to all kinds of foods, but really the pattern as I watched it was, for me, it was carbs. And so I had to start decreasing those foods, and that would make a difference with some of my symptoms. I had symptoms of dryness, dry mouth, dry eyes, dry skin, but also gut function, restless legs. Lots of these symptoms were improved, but then I would get to the next level, and eventually it was even carby vegetables like carrots and potatoes that started causing problems. So I ended up having to go really extreme with my diet, and if I had known this in the beginning, and if I'd had the courage to make a big change in my diet, it's pretty hard to change your diet drastically. Having really serious symptoms gives the motivation, I find.
Yeah.
So I changed my diet. I personally went zero carb, which is a meat-only diet. I tried a very clean GAPS, gut and autoimmune diet, but after 2 years, my symptoms were worsening again. So I changed my diet, and it helped calm everything down. For some people, getting rid of gluten is enough to cure their disease, rheumatoid arthritis, for example. For me, it was enough to, I did have improved energy, and my other symptoms, a lot of my other things calmed down, but it wasn't a cure for me. And even after 2.5 years, it wasn't a cure. But it's part of this how do you support your system? And so with everything calming down in my system, it's as though it's providing more room for my body's innate capacity to heal. It has more room, and it's helped my system begin to have more capacity. And so then everything else you start to do begins to help as well. So I was mentioning earlier, the multiple hits is how they talk about it in different research studies for different diseases, that it seems to be following multiple hits. Planting multiple seeds also seems to make a difference. It just can take a lot of time. So
what were you able to learn, either for yourself or for others that you've helped, that they can do to actually try to learn to take advantage of neuroplasticity to maybe mold the responses that are occurring in the autonomic nervous system vis-a-vis the various threats or hits?
the part where I just mentioned about supporting your system helps to start to tackle that perception of threat. A more direct way to work with the perception of threat, I really think that working with, if you've had trauma, and most people don't recognize that we've had trauma because it can be so subtle, but actually working with your nervous system from a somatically based trauma perspective, that means practices like somatic experiencing, EMDR, sensory motor psychotherapy. You've mentioned some of the neural retraining programs. These can help you decrease your system's fight, flight, freeze response. So that can also play a really big, important role. In my own work, in my own personal life, that's been the biggest, most helpful piece, has been how do I begin to decrease my own system's threat response. And so trauma therapies are one of them. The mind-body practices can be helpful also, whether it's meditation, mindfulness, yoga. They're going to be different for everybody, and there are challenges in doing these when our nervous systems are already at their extreme edge where we've gotten so sick. But
can you
yeah,
describe just a little bit about what you mean when you say somatic experiencing or even EMDR? Because I think maybe some of our viewers aren't aware with some of these different therapeutic approaches to try to mold or modify, you know, the fight, flight, freeze situation where we get stuck. And when we get stuck, that's where the symptoms come from, because of the somatic interplay between those parts of our brain and the actual body itself, whether it be the immune system or the digestive tract or the hormones or the muscles, bones, and joints.
so are you wondering how they work, or describing a little bit about
Just
each
so that
one?
people have an idea of each
Mm-hmm.
one, what does it involve? Maybe even just a working definition.
As a somatic psychotherapist myself, what I've learned to do is, how do you pay attention to a symptom, let's say, without getting fully pulled into believing everything the system is perceiving when you're in that symptom. So for example, you raised a question in a prior discussion we had about panic attacks. If you're having a panic attack, your brain can kind of go into complete fear that you're going to die. Your heart rate can speed up, and you can feel it pounding in your chest. And your system has been hijacked to feel that in this very moment, there's some kind of life threat. From a somatic psychotherapy point of view, what we want to do is hold a curiosity about that, and get any percent of ourselves that notices that this isn't actually true in this moment. And so you're orienting to the present moment. In this present moment, I'm sitting in this chair, in this space, in my home. I'm actually not in danger. And so that begins all by itself to feed different information to your nervous system in the present moment, that you're not under threat. And that helps you differentiate or separate a little bit from the symptom itself. And this not reacting to where your system has gone is how you begin to help your system separate it out. Oh, present moment, safety, this is from the past, from whatever kind of toxic exposures. They've made my system more sensitive to going in that direction. Does that make sense?
Yeah, in fact, I've heard so many other people say, and it seems to make sense to me and with my own experience, that these kinds of practices, like in that individual moment, realizing that that vegetative panic isn't really associated with a true threat, and then learning that you can actually move in a different direction once you can get your conscious mind to realize that the more you practice that, the easier that becomes. And the fact that you can interrupt that cycle quicker and quicker. In some cases, at the very first inkling of, I'm going to that anxious place that could end up as a panic attack. But then you can say to yourself, no, that's not reality. I don't choose to do that. I choose to go in a different direction. And then that different direction is not associated with the same somatic fallout, if you will.
Exactly. And just hearing this part, some people will think, well, that sounds like it's psychological and you're working from a psychological point of view. Therefore, my symptom must be psychological, especially if it's a panic attack. But this works in all kinds of settings. I just did a video interview with a woman, Ami Quirconi, who has rheumatoid arthritis, and she's applying this to her illness. And it's taken her a year to catch her first sense of what a clear trigger is. And what she's noticed is that certain kinds of people evoke a threat response for her based on childhood experiences, and that her very first symptom can be a sense of tension across her chest. And
or maybe a tightness in the throat.
A tightness in the throat, a tightness in your jaw, a sense of speeding up.
Yeah.
Yes, those are all part of either setting a boundary or a fight response. It's going to be a little nuanced and different for each one of us.
Some people feel something in the pit of their stomach.
Yes.
Like a flutter or just a churning or a tightening.
I feel with my fatigue, my whole system will drop. I'll feel collapsy or exhausted, and I'll believe it. It'll be like, oh, I must have just done too much. But what we're identifying is what the trigger is. There's a trigger in our environment. It can be a person, it could be a toxin, it could be a stressor that happened at work. They're all feeding in the same or different pathways to elicit a threat response that creates a symptom. So what Ami is learning is that this happens a few days before she gets an actual flare-up in her wrists and her hands. And then if you go further when you're exploring this somatically, is you look at what is the impulse in the system. And for her, she wants to punch the daylights out of someone. So it's a fight response that's gotten stuck because there wasn't any room in her childhood to actually express herself or set boundaries or use that impulse. So what we're doing is we're working with these intelligent underlying pieces in our systems, and we're giving them space to find a different pathway. And what you said was exactly it. It's introducing choice into the system. And what gets our system stuck in a cell danger response or in fight, flee, freeze is not having had a choice in the past. It may have been conscious, but generally we didn't have a choice at a nervous system level. If you're born prematurely, that's a very life-threatening situation. Even if you're in an incubator, being an incubator and separated from your mother is also really a life-threatening situation. And an infant has no choice. And so that can set up a pathway for a nervous system that will be much more sensitive to environmental stressors. Even if they're really mild and innocuous for other people, they might be much more triggering of that pathway to grow and strengthen over time in that individual.
Absolutely. So, for me, as a physician practicing environmentally acquired illness with people with chronic complex illness, I find that really I talk to people about focusing on three things. One of them is trying to identify the toxins so that we can avoid and eliminate. The second one is changing their own personal individual sensitivity to toxins. And the last thing, and the more I learn about it, the more I think it may be the most important, is that we have to pay attention to the way the brain, the trauma brain, or the threat response center of our brain, actually responds to the presence of all these other different toxins, including the life ones. And then by learning that we do have choices that we can take and that we can learn to use neuroplasticity, or basically developing new patterns of responding, that we can actually end up at the end of the day seeing different somatic responses on the part of our body, which actually ends up being these various symptoms of chronic complex illness, whether it's pain in the joints from rheumatoid arthritis, or diarrhea, or constipation, or fatigue, or confusion, or anxiety, or depression, or panic, or any number of things, or even of immune system depression, because we know that's very real. I mean, we've already done studies on rats to show that if we chronically stress and pester a rat, that we can see measurable decreases in that rat's immune system response. I mean, those studies were done a long time ago. Or that if you can look at the rat's adrenal response, the hormonal response of the adrenal gland, or even the thyroid gland, that you can see that persistent stress causes very real things to happen, and that by changing those patterns, you can see those changes to abate. So that's exciting.
It is, and I love what you just described. How you avoid the toxin or identify the toxin, whether it's a life experience toxin or something specific like a chemical. And as more as we can start to identify them and identify how our systems respond, this introducing choice, it can be very clear for some people, like removing that sack of potatoes. And for others, like for me, it's been a very long process. It's been 15 years of doing this work. It took me a year to catch my very first trigger. I'd never thought about it this way before. And once you start to catch these triggers, you do get more and more space in between the exposure and the symptom. You start to have more opportunities for what you can do about them.
Exactly. Gain space. I like that. It's what Annie Hopper talks about, trying to work at the margin of where you first start to trigger. And sometimes that gets a bigger and bigger space where you can find that you have more and more leeway to tolerate circumstances in your environment. But you always like to continue to do your work of telling your brain that this is something that you can choose to go a different way by practicing. You don't want to immerse yourself into things that trigger a really serious response, but you want to go right up to the edge of it so that you can teach your body from the edge, that you can respond a different way.
And this is an interesting piece too, in that you can do this very consciously and cognitively, as you're describing with Annie's work with DNRS. What's it stand for?
Dynamic Neural Retraining System.
Yeah, I'm less familiar with that. That's something that you have a lot of familiarity with. And it highlights that there are a lot of different approaches to help us come out of these states. There was another piece I wanted to mention here. So we can create more choice from up here, more awareness, so that we can actually make decisions, introduce the space to make choices about what we do, whether we might avoid a certain person or set boundaries with a certain person, if it's a life stressor, for example. But another piece of how it can work is, if you're working with it somatically with trauma therapy, you're also unwinding the unconscious threats that are embedded in our pathways in our nervous system. And then you don't have to use as much conscious awareness. And that can still be a part of what you use, but it actually unwinds and resolves something that is from the past that never got to know that the danger was actually over. And if our nervous systems can get the message that the threat is actually, it's in the past and it's over, then we don't get triggered into the symptoms today in the present.
That's amazing. Amazing stuff. So I think I'm going to go ahead and kind of leave it there for now, but I know that you and I are going to want to have more discussions and to try to go into this a little bit more. And I think more than anything, I think it's hopeful that we can help people understand that they need to look at these groups of symptoms from a different paradigm. And they need to, from my perspective, absolutely realize that there's every reason for hope. Because for some people, it's a very quick fix. They get rid of the bag of potatoes. For other people, it might be a process that might take years, and that the benefits and the successes are more smaller and incremental. But nevertheless, I think it's very important for people to celebrate every single minor success.
Absolutely.
See as they go down this pathway, because at first that's the way it is. You know, it's not going to be an aha moment, although it can be an aha moment. Hopefully we've caused a few people maybe to have an aha moment today with just our discussion. But it generally takes a process of practice. So I'm gonna stop it here, but thank you so much for taking the time with me today. I think this is gonna be making a real difference for people.
It's been great talking with you.